Hello everyone. We are starting a new educational series on Drugs Price Control Order 2013 or DPCO for importers and manufacturers of medical devices and equipments. In this video, we will explain the pricing related compliances that the manufacturers and importers of medical devices have to comply with. In the subsequent videos of the series, we will discuss the process of filing the price related information on the dedicated online portal and restrictions on price increase of medical devices. We will also discuss mandatory compliances related to medical devices under DPCO. To know more about the mechanism to report the prices and other compliances applicable to medical devices under DPCO, make sure you subscribe to the channel and press the bell icon to receive notifications for the latest updates. To begin with, the first thing that we need to understand is what is DPCO? Drug Price Control Order is an order which is issued by central government under Essential Commodities Act 1955. This order enables central government to regulate the prices of all medical devices by fixing, revising, monitoring, and thereby controlling the prices to keep them at reasonable levels. DPCO categorizes all medical devices into scheduled and non-scheduled formulations. The authority that regulates the prices of medical devices and equipments in India is NPPA, that is National Pharmaceutical Pricing Authority. It is an independent body of Government of India established under DPCO. NPPA is entrusted with the following functions. It is responsible for fixation and revision of prices for certain drugs and medical devices listed in the first schedule of DPCO. It is also responsible for monitoring the prices of drugs and medical devices that are not listed in the first schedule of DPCO. Furthermore, it is also responsible to implement and enforce the provisions of DPCO. Now, it is very important to understand what are scheduled and non-scheduled formulations. First, let us understand what are scheduled formulations. Scheduled formulations are any formulations that have been listed in the first schedule annexed to DPCO. This first schedule is also called as National List of Essential Medicines or NLEM. The NPPA fixes a ceiling price for all the scheduled formulations. Ceiling prices is a price above which a scheduled medical device cannot be sold to the end consumer. Till date, the medical devices that fall within the category of scheduled formulations are coronary stents, condoms, and intrauterine devices. Now, let us understand what are non-scheduled formulations. Non-scheduled formulations are the ones that are not listed in the first schedule of DPCO. The prices of non-scheduled formulations is only monitored by NPPA to ensure that the manufacturers or importers have not increased prices by more than the prescribed limit. All other medical devices, excepting those mentioned in first schedule of DPCO, are non-scheduled formulations. Now, under DPCO, manufacturers and importers have to submit price related information about their medical devices and equipments to NPPA. Whenever there's a revision in MRP of the scheduled medical devices, importers and manufacturers of such medical devices are required to inform about the revision of MRP to NPPA in Form 2. Manufacturers and importers of scheduled medical devices are also required to submit the production, import, and sales data on quarterly basis in Form 3. Lastly, whenever there is a revision in MRP of scheduled or non-scheduled medical devices, an intimation about such revision is required to be submitted to NPPA, to dealers, and to state drug controllers in Form 6. Form 6 is also known as Revised Price List. These forms are submitted on the online portal developed by NPPA called Integrated Pharmaceutical Database Management System or IPDMS portal. The detailed process of submission of these forms will be discussed in our upcoming videos. Hope you got the basic understanding of what DPCO is and what are the pricing compliances applicable to manufacturers and importers of medical devices and equipment. Thank you for watching.